Welcome to Chapter 1, Human Body Orientation. What I want you to do is to look at all the PowerPoint slides first, because I'm going to comment on the slides. I'm not going to read them to you. Having said that, let's get started. So, this is a review of the first half of an anatomy and physiology textbook. And anatomy is the structure, and physiology is the function. But they complement each other. So the body has certain tissues and cells and organ systems, and the way that they are structured will reflect differences in their function. We certainly can have certain structures be macroscopic. You can see them with your eye, and there are other structures that would have to be seen under a microscope. So physiology is the study of the function of the body, and usually the second semester of an A&P course goes more into the various organ system functions. Now, the principle of complementarity is something that I want you to know, because the structure of the heart is quite different than the structure of the brain, for example. And the reason why they look differently has to do with the fact that they have two very different functions. And so the structure should complement the function, and the function should complement the structure. And it does. The way that most A&P textbooks are organized is from the very small to the very large, so that often the first semester emphasizes chemical, cellular, tissue, and it might go into a couple of organ systems like the skeletal system, muscular system, and nervous system. But then the second semester is more about the organ systems of the organism, like cardiovascular, like pulmonary, like renal, like central nervous system, peripheral nervous system, things of that nature. And how the organ systems are controlled by the brain, and control the brain, and control endocrine and hormones, and how they control each other and assist each other in disease is really the purview of the second semester. And this is just showing you in a pictorial sort of way, the progression from atoms to molecules to organelles to tissues to organ systems to the guy holding the tennis racket, the organism. Homeostasis. No homeostasis. I will so bore you with homeostasis as not to be believed. Homeostasis actually comes from the Latin, which means to stay the same. And the idea is that you want certain processes in the body to stay the same, no matter whether there are changes within or changes without. Temperature is a good example of this. pH of the body is a good example of this. So with temperature, you want your temperature to be 37 degrees centigrade. You don't want it to be above or below. If there is an increase in temperature and it's not due to fever, then the body will start to sweat, and that will cool down the body, get the temperature back to 37 degrees C. If it's cold, you start to shiver, and that shivering of the skeletal muscle will generate heat, which will get you back into 37 degrees C, because that's what the body wants. The body wants the body temperature to remain at 37 degrees C no matter what. So homeostasis is something that carefully regulated, and there are ways that the body will communicate any change, either within, without any change, and then counteract that change so you get back to where you were in the beginning. You want to stay the same. So you have, let me show you this next slide, the components of homeostasis. You are going to have some sort of receptor. These are going to be sensory neurons usually, that when they're triggered, you could have a change in pressure, you could have a change in temperature, you could have a change in, I'm trying to think of something besides pain receptors. So these sensory receptors are going to tell the control center, because the sensory neurons will travel to the brain, which is your control center, your central nervous system, brain and spinal cord, and that information will be received. And then there will be examination of the information and decisions made about how to proceed. And the effector response is going to be, like in the case of a change in temperature, these would be motor neurons that would say the temperature is down and you want to start to shiver to generate heat. These effector motor neurons would then discharge their signal to skeletal muscles, and the response would be to have them cause the shivering, which would then generate the heat, which would get your body temperature back to 37 degrees C. So the way that the body maintains homeostasis is this receptor giving the information to a control center, which gives the information to an effector neuron that would cause a change that would get you back to where you were. So this is just showing you another way of thinking about it. A balance and a scale going up and down might speak to you, and if so, that's great. But the whole idea is that, especially second semester A&P2, it's going to be a lot about these feedback mechanisms in order to get the body back to homeostasis. And the way it does it 90% of the time is what is called negative feedback. Negative feedback, it's an unfortunate term because most people think negativity. It's really a way of returning a system by doing the opposite. So if your heart rate went up, you would be able to feed that information to the brain. The brain would respond by doing the opposite, because homeostasis wants a heart rate to be, 70 to 90 beats per minute, and all of a sudden it's 100 beats or 120 beats per minute because you become scared of something, or there's a panic attack or something like that. And so that increase in heart rate is going to be fed by effector neurons to the brain. The brain is going to respond by breaking that, by trying to lower the heart rate back to normal. So because it's the opposite, high heart rate, you want the opposite to happen, lower the heart rate back to normal. It's called negative feedback. But these negative feedback loops are used so often in order to get whatever has changed, either too high, too low, and the opposite. So if your heart rate gets very, very low, you're going to have that information going to the brain, and the brain is going to then cause an increase in heart rate. Just something to do the opposite to get you back to where you were, get you back into homeostasis. So this is just showing you the example of sweating or shivering to get the body temperature back to 37 degrees C. Does the body ever use positive feedback? Very infrequently. No, maybe 10%. That's it. Because most of the time you certainly don't want to have a high heart rate of 120 go to a heart rate of 220. You'd rapidly die. But there are two very striking things that can happen to the body that they would want to have it be positive feedback. And the first is childbirth. So a woman ready to give birth to a child is going to start to have contractions. And the contractions in the beginning are pretty small and easy to ignore, and then they get more and more intense, because you want to be able to expel the child and birth the baby. So uterine contractions are a positive feedback. They start small and they become very intense at the end. That's one example of a positive feedback. The other has to do with stemming the flow of blood if their blood vessel is cut. And you start off with a very small platelet plug, and then that plug gets larger and larger, and it starts another cascade that will then form a fibrin blood clot that, again, is going to get large enough to stem the flow of blood, and so forth and so on. So all of us have clotting factors, all of us have platelets, but it's kind of a situation where you injure the blood vessel, the amount of platelets there at the time are going to be low in number. But because of positive feedbacks, you are going to have more and more platelets adhere, and then you're going to have more and more fibrin strands make a fibrin blood clot. And that is a positive feedback. Everything else is negative, but childbirth and stemming the flow of blood from an injured blood vessel is positive feedback. So you have an example here of the platelet plug, positive feedback, and gee golly whiz, no slides on childbirth. There you go, but I think people can understand that example. So we're at the end, and I'll look forward to seeing you for Chapter 3, Part A.